Is coming in from a friend who has just asked and said that she gets pregnant very easily, but as soon as she gets pregnant, the pregnancies do come out at 3 months. The pregnancies do come out as soon as the baby makes 3 months. She is asking herself, what could be the main reason as to why the pregnancies do come out? In this video, I'm going to answer this question. This video is going to be in 2 languages, the English language and the Luganda language. Mkwano gwaffe abuzize ekibuuzo kino n'agamba nti ye embuto azifuna bulungi naye aba yakafuna bw'ati olubuto ng'omwana yakaweza emyezi 3 emyezi 2 olubuto nga luvaamu. Ali kwebuuza kiki kyennyini ekireeta embeera eno. This video is going to be in 2 languages, the English language and the Luganda language. So stay on the video and you are going to get the answers to this particular question. Probably you could be knowing someone who is having a similar condition. Feel free to share this video with them. It could have a positive effect on their life. They could learn something about as why they are experiencing what we call repeat pregnancy losses. When fertilization has taken place, the fertilized egg, also known as the blastocyst, also known as the morula, it's going to pass through the fallopian tube of this particular lady, and then when this fertilized egg, assuming that the fallopian tube is normal, assuming that the fallopian tube is patent, it is open and it is healthy, the fertilized egg will go through the fallopian tube backwards to the wall of the uterus, to the wall of the uterus, also known as the endometrium. We call this implantation. This fertilized egg will attach itself onto the wall of the uterus, and the pregnancy will actually begin growing from there. The baby will begin growing from there, or the fertilized egg will begin growing through the stages, whereby it will become an embryo, later on become a fetus, and then later on become a baby. Now, the question is that she gets pregnant. The whole process of fertilization takes place very well. The fertilized egg goes through the fallopian tube very well. It attaches itself onto the uterus and it begins growing. But as the pregnancy is making 3 months, the pregnancy ends there, the baby comes out. What could be the problem? So the first reason could be due to the quality of the woman's eggs. If the quality of the woman's egg is not good, if the quality of the eggs of the woman is not good, then there could actually be a risk in such a way that when this egg of poor quality has been fertilized, it could actually have difficulties growing up to term. Mbadde ndikwogera ku kibuno ekibuuzo n'engamba nti process eno yonna ya fertilization we taking a place bulungi, eggi lino ne liba nga libadde fertilized ne liyita mu luseke ne ligenda paka ku kisenge ky'anabaana ne lyekwata ku kisenge ky'anabaana ne litandika okuba nga likula. Kino kye tuyita implantation. Singa kisangibwa nti omwana ono yeekutte ku kisenge ky'anabaana oba eggi lino libadde fertilized yeekutte ku kisenge ky'anabaana liri kukula, lirina okugenda paka ku myezi 9 kye tuyise up to term. Singa kisangibwa nga omutindo ogw'eggi lino eryabeera fertilized, omutindo ogw'eggi eryabeera fertilized eryafuuka omwana, bwe guba nga omutindo gwali munafu oba tegwali mulungi, kye tuyise poor egg quality, then kiyinza okuba nga bye bimu ebiviiriddeko okuba nga mukwano gwaffe afuna embuto bulungi naye tezigenda paka ku myezi 9 olw'okuba nga omutindo ogw'amagi ag'omukyala ono guyinza okuba nga si mulungi. Omukyala amanya atya nti amagi ge omutindo gwe si mulungi oba teguwera bulungi oba amagi ge manafu? Alina okuba nga agenda mu ddwaliro erimuli okumpi n'alaba dokita we, and then of course waliwo tests nyingi ezisobola okukolebwa okuzuula omutindo ogw'amagi guli gutya, nga test gye bayise the anti-Mullerian hormonal test. Kimanyiddwa bulungi nti mu ggi lino erikuze erigenda okufuuka omwana lye tuyise the dominant egg oba lye tuyise the Graafian follicle, lina obutoffaali obuli munda bwe bayita the granulosa cells, bufulumya hormone gye bayise the anti-Mullerian hormone, AMH hormone. Hormone eno erina kubanga eri between 1 up to 4 ng per mil. Singa kisangibwa nga omutindo guno ogw'amagi munafu, then wayinza okubanga wabeerawo risk nti kituufu egi lino lijja kubeera fertilized, lijja kujja lyekwate ku kisenge ky'anabaana, naye just because omutindo gubadde munafu liyinza okufuna difficulties oba liyinza okufuna obuzibu okweyongerayo okukula okufuuka omwana. So the quality of the woman's egg oba omutindo gw'amagi ag'omukyala. The next reason as to why a woman could be experiencing repeat pregnancy losses. She gets pregnant very well, but as soon as the baby is growing, as soon as the pregnancy is still in the first trimester, or as soon as the pregnancy is crossing the 3rd month, the pregnancy ends in a miscarriage. The first point was the quality of the woman's egg. We call this poor egg quality. Next reason as to why she could be experiencing repeat pregnancy losses could be due to the quality of the man's sperm. Because you could do the test to check for the quality of your eggs as a woman, and the test results could show that your quality is very good, because we know that for a woman to know the quality of her eggs, for a woman to know whether she is actually ovulating very well, or whether she can actually still get pregnant, whether she has entered into menopause, she has to do a test known as the AMH test. This is a test which will be requested by your doctor, which will be done by your doctor, and then your doctor will be able to assess or interpret the results for you. Remember, the normal AMH test results should be 1 up to 4 ng per mil, 1 up to 4 nanograms per mil. If the results show that it is actually higher, AMH is higher than 4, it could mean something. If the results show that the AMH results or the AMH is below 1, maybe it is in 0.01, 0.02, then it could signify, or it could indicate, what we call poor egg quality. The first part was actually talking about the egg quality. So the next reason as to why a woman gets pregnant but at 3 months the pregnancy comes out could be due to the endometrial or the health of the uterus. When I talk about the health of the uterus, I've talked about uterus several times, but I will actually talk more about the endometrium, the wall where the baby is supposed to attach, the wall of the uterus, the inside of the uterus. If it's not healthy, then it could be among the reasons as to why our friend gets pregnant, but the pregnancy does not cross the 3rd month. Ekirala kisobola okubanga kiri kuleeta embeera eno, wadde twogedde ku mutindo gw'amagi oba omutindo ogw'enkwaso eza bbaawe, kiyinza okubanga kikwatagana n'abaana yo nga kennyini nabaana nga muli munda tebadde healthy, oba nga muli munda erimu amazzi amakyafu, erimu conditions ez'enjawulo, maybe alinamuko n'ebizimba, naye ng'ate ebizimba bino biri munda munabaana omwana mwalina okwekwata, mwe tuyise the endometrium. Bino ebizimba baba babiyita the submucosal fibroids. So singa kisangibwa nga munda mulimu nabaana mwakosebwa, then kiba kitegeeza nti nabaana yinza okubanga tesitula lubuto okusuuka emyezi 3. So kyandibadde kirungi mukwano gwaffe n'agenda mu ddwaliro ne bamukolako tests ez'enjawulo okukonfaminga nabaana ye muli munda eri etya. So I was talking about the health of the uterus, and I was saying that if a woman's uterus is not healthy, the inside of the uterus where the baby is supposed to attach, if it's not healthy, maybe there's fluid that has collected there. We call this chronic endometritis. Maybe there are conditions that have affected the uterus in general, then this could actually make it difficult for the uterus to carry a pregnancy. Next reason as to why she could be experiencing repeat pregnancy losses could be due to the health of the cervix. The health of the cervix. If the cervix is weak, the cervix is the opening of the uterus. If a woman's cervix is weak due to maybe repeat pregnancy losses, due to maybe abortions, or due to infections that are actually very chronic and they do not go away, or any other procedure that was done that actually weakened the cervix, it could actually lead to repeat pregnancy losses, and this can be managed in a hospital near you. If you are feeling unwell, you are getting repeat pregnancy losses, go to a hospital near you, talk to your doctor, and they will manage you. ekirala kisobola okubanga kireeta embeera eno kiyinza okubanga kiva ku mumwa gw'abaana bwe guba gwanafuwa. Ne ngamba nti oba tewulira bulungi gende wa dokita wo ajja kuba akukolako. Osobola n'okubuuza ebibuuzo mu comments, nja kuba nkuddamu. You could ask your questions in the comments. I'll be able to answer all your questions. Have your